Welcome back, everyone, and thanks for watching Good Things Utah. Well, I'm here with Dr. Gordon, who is Dr. Jordan, I should say, who is the surgeon over there at Ogden Clinic, and we're talking today about people who will get a better result if they're mentally and physically prepared for surgery.
That's true.
What do we do? Step number one.
I think the first step is to do a little bit of research about your diagnosis, your condition, and then if you're going to be assigned to a surgeon, I think it's also important to start researching the surgery that you're advertised as needing.
Okay, so let's just talk about, we're going to go in, what's a common procedure that you would...
Say a gallbladder operation.
A gallbladder operation. So I come in, I'm diagnosed, okay, how do I prepare for that gallbladder operation? What are some of the best things to do?
I think, again, do a little bit of research before you actually come for that surgical visit.
Yep.
And then I think it's also important to bring a soulmate with you, a confidant, a loved one.
Good idea.
Absolutely, because that way you have someone who can almost act as a sounding board during the course of the visit, but also most importantly afterwards, because you're already stressed and you're going to miss things. So if you have someone there with you, they can pick up on that.
And also remembering things like
Absolutely.
You just said, because I'm sure that, you know, when you are listening to your doctor or your surgeon like yourself, you would miss things because you are stressed.
Absolutely.
Okay, so what are some of the... you said a second opinion. Are you saying that after you've been diagnosed, you should then go and get another opinion from another doctor or surgeon?
No, not necessarily. I think the recommendation for a second opinion oftentimes comes from the surgeon himself or herself.
Yeah.
Let's be frank. If it's something that we as surgeons don't do a lot of, then we'll be the first to actually offer a second opinion. But again, the old saying, the common things are common. Most of the things that we see are common. And I think if you see a surgeon who does a lot of common operations, you're probably in good hands.
Okay, asking surgeons, because, let me step that back, sorry. If I go home, research the procedure or the diagnosis, sometimes you can overanalyze yourself at home. And then you come back to someone like you and you've got 50,000 questions, but they could be wrong.
Absolutely.
Doesn't that cause more pressure? And how do you get the client or the patient to become calm again?
You can tell when people have done their research from a reputable site and when perhaps the sites haven't been as reputable. But it's one of our jobs as that person's doctor to bring them in out of the wild, if you will, to make sure that their research has been done correctly and to fine-tune what it is that they're there to ask about.
Some of the top questions that me as the patient need to ask you as the surgeon. Recovery?
Recovery,
How
absolutely.
long is the operation
and it depends, and it depends on the nuances of the surgery. Depending on what surgery you're there for, the recovery is going to be different. I always tell people that for the first 3 or 4 days, 5 days after the surgery, you're not going to like me very much.
Yeah.
And people look at me and say, well, why is that? Well, it's because of pain. But I think if they know that there's going to be pain for 3 or 4 or 5 days after, they appreciate that forecast. It's just like a weather forecast. As bad as the storm is that's coming, if you know it's coming and you can prepare for it, then it's a little bit smoother to get through.
A lot of people talk about the issues with anesthesia. What can you do in dietary issues leading up to your operation and then afterwards knowing you're going to be put under with anesthesia?
Anesthesia is a whole nother bag of worms, if you will, and we're very liberal about sending our patients to see one of our anesthesia colleagues in what's called a preoperative clinic.
Great idea.
This is a good place for you, again, to come with family. Ask specifics about anesthesia. There's a lot of misconceptions about anesthesia. Am I going to be awake during the procedure? Am I going to remember the procedure? I think that it's the anesthesiologist's prerogative to talk people off the ledge, if you will, when it comes to concerns about the anesthesia.
I worry about it, Dr. Jordan, because I think if I'm going to have an operation and the misconceptions that we have out there about anesthesia saying it's so bad for your body, it drops your immune system for later on in life. Are those sorts of things real?
I think there's some veracity to that, no doubt about it. And that's why it's important to see the anesthesiologist to see if there are alternatives. It's not all general anesthesia. Oftentimes we can do things with a spinal anesthetic and epidural anesthetic. Local anesthesia, IV sedation. So that's one of the good things that you can talk about with the anesthesiologist.
Okay, so definitely not gallbladder, but let's just talk about if there is an option not to have the surgery and it can be done, you know, holistically or with diet, or they can be fixed. Would you recommend that path?
It's paradoxical, but oftentimes...
Well, that's a big word for this hour of the morning.
But don't ask me to spell it. It's paradoxical, but But ironically, a lot of the patients that we see in the office don't have surgery, and it's a little upside down. You're a surgeon and you're talking people out of the surgery. I always tell people, if it isn't broke, don't fix it. We should only go to the operating room when there is no alternative other than the surgery. We should try conservative things, do everything we can short of an operation before actually going to the operating room.
I love your attitude on that. Thank you so much, Dr. Jordan.
Thanks for having me.
I love those answers as well. If you want to find out more information about Ogden Clinic and Dr. Jordan there, you can call our webpage at 801-475-3000. That's their phone line, I should say. Or you can head over to our webpage and we will give you all the details that you need. Hey, Glenn, some great information there, because it concerns a lot of people.
Very important information, that's for sure.